Southern California. My life passion is to help women with breast cancer. And I love giving these talks because I think it's a unique opportunity to teach. And I love teaching. And I feel like women, the more they know about breast cancer and when they get diagnosed with breast cancer, the more they know about their breast cancer, the more empowered they are to make decisions. And it changes everything when you don't know things that sometimes is a place that becomes very scary. So I'm just going to give a light overview about breast cancer and some things about myths and facts and screening. And then I'm more than happy to take any questions at the end. So this is just an overview of everything we're going to talk about. As many of you in the room probably are aware, breast cancer is very common. It is the most common type of cancer amongst women. Skin cancer is technically the most common, but in terms of real cancers, breast cancer is the most common. Thankfully, it is not the most common cause of cancer-related death. That is lung cancer. Whenever I share this, I always want to point out that colon cancer is number 3 for both men and female. So I try to ask my patients if they've ever had a colonoscopy, if their partners ever had a colonoscopy, and remind people that that's another great screening tool to hopefully find early stage cancers, and also even prevent some cancers by moving polyps. So it's 1 in 8 women is the statistic. The breasts were primarily made for breastfeeding. So most women, when they get breast cancer, it's either of the milk gland, which in the medical world we call lobule, or in the milk duct. There's a few other kind that are kind of mixed or less common, but most women get diagnosed with a ductal cancer. And within ductal cancer, there's 2 types. There's a kind that kind of starts inside of the duct, just stays there. And then there's a kind that can spread outside of the duct, and that's a real cancer and can spread to lymph nodes. Lobule cancer, which is the milk gland cancer, is a little bit less common, but it's not less common in like a scary way where it means that it's a worse prognosis. Within those 2 types, so like someone having a milk gland cancer or milk duct cancer, there's actually a lot more subtypes. And this all has to do with these 3 really important things. And they're receptors that live on the cancer cells. And this really drives women's like prognosis, if they're going to need chemotherapy. So if you imagine when anybody gets a biopsy, they check their cancer cells to see if they like or don't like these 3 things: estrogen, progesterone, and then this funny name HER2, which is like a little protein that can live on cancer cells. So most cancers love estrogen and progesterone, and that's the most favorable type. One of the more aggressive types is called triple negative, where it doesn't like any of these 3 things. The reason why it's more aggressive is we don't know how to kill it as easily. When you know it likes estrogen, it's really, we have these pills that can starve estrogen out of the body. And so if there's a cancer cell, it can die. But in terms of the triple negative, they can sometimes be a little bit trickier to treat. City of Hope is doing amazing trials for triple negative. All of the breast medical oncologists are supporting one named Dr. Yuan, whose basically life goal is to also try to figure out a way to kill these different types of triple negatives. And then HER2-driven positive cancers used to be a little bit more tricky to treat. My mom actually had a HER2 positive breast cancer. In the early 2000s, there was a miracle drug called Herceptin that was found, and that kills those cancer cells. And now it has a best friend drug called Perjeta that we give to a lot of patients. And this just allows us to, again, really individualize cancer treatment to each woman, tailor everything to their type of cancer. This is an overview of what women go through in terms of like different treatment options. I always tell women that we treat the breast locally, which is usually me and a radiation doctor. We also treat the whole body, which is a medical oncologist. And there's so many different tools that each doctor has to try to, outsmart their cancer. And again, each of these steps is pretty individualized. In terms of what I do, there's main 2 surgeries for the breast. There's either removing part of the breast, in which case women need radiation. I will say that for women over the age of 70, when they have really favorable breast cancers, radiation is not routine anymore. And then women also can have a mastectomy where we remove the whole breast. Sometimes they still need radiation if they have this. There's different types of mastectomies. Sometimes we're able to save the nipple. Sometimes we're able to save a lot of the skin. And there's a lot of awesome reconstruction options. A lot of women wonder like which one's better, and the honest truth is they've both been proven to be equivalent in terms of survival. So one surgery is not better than the other one, but there's pros and cons to each. So we kind of navigate those surgical decisions all the time with patients. This is a screen just showing how much women go through just to get to that point where there's survivals. And this is just a typical outline for like an estrogen-driven breast cancer. A lot of women go in for their screening mammogram. They get a call back. They go for more testing. They eventually get a biopsy. And then I usually see them in my office. We complete a workup. We go to surgery. Then they're waiting for these pathology results. Oftentimes we get a special test to see if they need chemo. So it's a tremendous amount of waiting and anticipation and journey. And I really admire everything that every patient goes through to get to that point where they are in the survivorship category. I'll shift gears right now to a little bit more about some myths and facts and some screening questions. So a lot of people think if their mom didn't have breast cancer that they won't get it. That's not true. Actually, the minority of breast cancers are thought to be hereditary. Meaning if I see, maybe 100 patients in a week, probably only about 5 to 10 of them actually have a gene that they were born with from their family that we know about, that I can say like caused their breast cancer. So most women don't have a family history of breast cancer. And then even if they do have a family history, we may not even have a gene explanation. And we really don't know why so many women get breast cancer. We don't know why there's so many different types. I truly believe there's a stress component to it and environmental factors that are just so complex that we haven't, been able to figure out it's one thing. But still get your screening and encourage your family and friends to, even if you don't have a family history. A lot of people think that there's nothing they can do to decrease their breast cancer risk, and that is not true. Regular exercise definitely decreases the risk of breast cancer. Any sort of weight loss decreases the risk of breast cancer. Healthy diet with fruits and vegetables, and actually limiting alcohol use. The reason why exercise and weight loss decreases the risk of breast cancer is when we have excess fat in the body, that actually makes estrogen. And so if a lot of cancers are fueled by estrogen, having that excess estrogen in the body may be the thing that kind of is a little bit of fertilizer to get cancer to start growing. So we've seen in a lot of studies, if you lose weight after menopause, that reduces your risk of breast cancer. I think healthy diet is amazing. The more fruits and vegetables you can eat, the better. Those are the two things that have not been shown to cause cancer. But it takes a lot of commitment, and I'm vegetarian. I don't think you need to be vegetarian, but you do have to eat, I feel like, more frequently if you eat healthier, and it's a lot more meal planning. Alcohol, it's about less than 1 drink a day. We've seen is not associated with the breast cancer risk, and more than that is associated. So in other countries, like in Italy, where they drink a lot of wine, we actually do see more breast cancers they think are contributed to alcohol use. Men can get breast cancer. I don't know if there's any men on the line, but I do see probably 1 or 2 patients a year who are male with breast cancer. It's extremely rare. Self-detection is the most important thing. So just if at some point they get a physical, or at some point they can keep an eye on the tissue behind their nipple, that's usually how men present, as they feel something right behind their nipple. Antiperspirants and deodorants are a really popular thing. A lot of women, once they get breast cancer, they switch to crystal deodorants. There really hasn't been any evidence that these products are associated with breast cancer. Like, they have not been able to link it. Everybody has to make a decision that's the best for them. Also, underwire bras do not increase the risk of breast cancer either. I use both. I use antiperspirants, and I again don't feel that it's dangerous. mammograms causing cancer. A lot of women are really scared about mammograms actually causing breast cancer because you get a little bit of radiation. Mammograms are the gold standard for early detection of breast cancer. I think mammograms are completely safe. The amount of dose of radiation outweighs the benefits of finding an early stage breast cancer. And the dose of radiation is equivalent to about a month of radiation from walking Earth. I think like flying back and forth from China is a little bit more radiation than a mammogram. So we get radiation as a daily risk, and mammograms are worth it. I would not hesitate to have a mammogram. When to start mammograms? I see women of a huge range of age with breast cancer. In the last 10 days, I saw a 29-year-old, and actually I saw two 89-year-olds. And the question is when to start. I do believe in starting mammograms at age 40. Some of the societies think that it's appropriate to start at age 50. A lot of the arguments are that when you're young, your breast tissue is kind of dense, so it makes the mammogram not as easy to read. And so they think that maybe it's not as useful. And then women get these callbacks and it turns out to be nothing. And that's just not worth the stress at like a global level. But because I see so many women with breast cancer, I have that bias that if there's any chance to find it earlier, like let's do it. Let's take the risk of, the dense breast tissue and these callbacks. So I like to start at age 40 and every single year. When to stop is always a question. And I really think that you should keep going as long as you're healthy. The question is sometimes if you wouldn't be healthy enough to undergo like a treatment for a breast cancer, then maybe we don't need to screen. I see women all the time of breast cancers, 80 or older, that were able to still cure and treat really successfully. So we talked about the background on breast cancer, 1 in 8 women, different types of breast cancer, so ductal versus milk gland, and then these hormone receptors, which are so important, estrogen, progesterone, and HER2, and these really drive the treatment women get and also their prognosis. How we treat breast cancer with surgery, sometimes with radiation and treating the whole body, and then some myths and facts and screening. I look forward to any questions you guys have. I met in June with this group. I'm sorry, in November, and you guys had such great questions.
Hi, this is Toya. I see a question in the chat box. So
Okay, great.
I'm just going to ask that. And for anyone else who has questions, please feel free to unmute yourself and you can ask the doctor directly, or you can type it in the chat box. So this question is, my friend over 70 had a mastectomy and can't decide whether or which hormone blocker to take. She reads the side effects and is fearful. How can she get more info?
Yeah, that's great. So when women, even when they have a mastectomy, because a lot of women think if they have a mastectomy, and I'm not saying this is what your friend thinks even, but a lot of women will want to have a mastectomy to avoid any systemic therapy like chemo or an anti-hormone pill. And it's still important to take that because breast cancer, once it becomes invasive, can spread somewhere in the body, just like a single cell somewhere, even sometimes when lymph nodes are negative. And so we treat the body to try to kill those cells that may have escaped and are hiding somewhere. So in cancers like estrogen, we have these special pills that can block the estrogen. So just like we were talking about, it kind of like starves it so that cell can die. There's quite a few options for these anti-hormone pills. The first and classic one was tamoxifen. And then they came out with a new class called aromatase inhibitors. And those are used in postmenopausal women to block the enzyme in the blood that makes estrogen from steroids from your adrenal glands, because your ovaries are asleep at that point. And so I would just say that she should speak with her medical oncologist and try one. Try it for 6 months. If it doesn't work out, switch to a different one. That's the one great thing is there's not just one, so you can try different ones and see how the side effects affect you. A lot of women are really scared of the side effects. If you read about it, you can almost just start to like feel nauseous reading all the different things it can cause. But I think it's worth trying. And I usually tell people if you can try it for 6 months, a lot of the side effects do seem to dampen. Um, but she should try at least one and then see, and then go to the next one.
Do we have any other questions? You can, again, you can unmute yourself or you can type it in the chat box. I see there is a question. Is there any correlation between menopause, hormonal therapy, and breast cancer?
Yeah, absolutely. So in terms of lifetime breast cancer risk, after menopause, the risk of breast cancer does go up. So I see young patients with breast cancer, but most women would be diagnosed like 50 to 70. A lot of women, when they go through menopause, use hormones to kind of replace what they're losing to stop some of the side effects. A lot of it being hot flashes and trouble sleeping and mood changes. There was a huge study called the Women's Health Initiative that looked at the relationship of hormone use and breast cancer risk. And yes, the longer you use hormones, the more increased risk you have of breast cancer. So I would say 5 years is a magic number that you should not use them longer than that. And then on top of that, combination hormone therapy, so using estrogen and progesterone, is a little bit more increased risk of breast cancer versus estrogen alone. And so everyone, it's like a risk to benefit ratio. You know, I do see women get breast cancer that have been on hormones, and I see women, you know, most women that get breast cancer haven't been on hormones, and you just have to do what you have to do to get through that menopausal changes. But no, I don't want women staying on it for 10, 15 years.
Thank you for that. Do we have any other questions? Okay, I see. Can you talk a little bit more? And I'm sorry, I'm looking at two
no
different
problem.
screens.
You know, it's
so
funny. I can't see the
um,
chat, so I think you just see it, right?
yeah, I think so.
Unless
But
maybe I'm gonna try
and
to
then
just
there's
stop
another.
share and then see if I can see it. Okay, let me see. Oh no, now I just see the one question. Maybe the questions are to you.
Yeah, they're
Okay.
coming to me. So can you talk a little bit more about the environmental factors that causes breast cancer and ways that we can decrease our exposure?
It's a great question. That is like the $1 million question of like, why are women getting these breast cancers? So I do think there's something to do with stress. And so I think that people need lifelong ways to cope with stress that don't allow us to like hang on to that like negative energy or, you know, just stress in our body. I think that the more fruits and vegetables we eat is very protective, and things like, and again, this is impossible to avoid because I look at this all the time in my life, you know, things like plastics. All of our food comes in plastics. We're heating up food in plastics. You know, a lot of people think that we should be using only like glass and things like that to store food. So you can kind of go down a rabbit hole of different things to try to control. And a lot of the things you know you can't control. So that's why I think that if you can exercise, control your stress level, lose weight, and eat fruits and vegetables, that's probably the most practical thing that you can do.
Thank you. Do we have any other questions? You guys have some really good questions.
Yeah, thank you guys so much for your questions. They are great and they make me think about things. I just want to encourage again, mammograms, colon cancer screening, all of the things that are good for breast cancer risk reduction are also good for your heart. Heart disease is still the #1 killer of women A lot of people have a misconception that, men get heart attacks, women get heart attacks too. That's the most common cause of death. And so all of these things that are good for breast cancer reduction risk are also good for your heart. And there's also, if anyone knows smokers, I feel like this also hasn't become widespread, but there's lung cancer screening. So lung cancer is the most deadly cancer. And we have screening now if people have a history of smoking and are high risk. And that's a way to find, again, cancers early so that they're treatable and curable.
I have another question. Are
Yes.
there different types of mammograms?
There's two main types of mammogram. So there's just the simple 2D mammogram, which is the most common. And what they do for that is they take a picture of your breast, squeezing it this way and then squeezing it this way. And so you get 4 pictures total, 2 on each side. And that's the standard way to do a mammogram. There's a newer way called 3D mammogram, or tomosynthesis. And what that does is it takes actually quite a few pictures of your breast, like in slices. So instead of just taking a single picture like this, it takes like picture, 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 almost like if your breast was like a sliced loaf of bread, instead of just like looking at it one way. Those are becoming quite common. We do use those at City of Hope, and I think everyone's local. Arcadia Radiology just got one there, as well as Hill Imaging also has them. The pro of those, and there's been studies that women in denser breasts, so 40 to 50, it can decrease the chance of a callback, which means that they see something and they go back and they get more imaging where they often have to like squeeze the breast a little bit more and they'll be like, oh no, that wasn't a mass. It was just breast tissue. It was hard to tell. So it decreases that. It also has an increased sensitivity to find an early stage breast cancer, and most of them are the estrogen driven kind. Just again, instead of looking at everything overlapping, the radiologist is to look through the breast a little bit more. The downside of it is not all insurances support it, and it's just a little bit more radiation.
Thank you. Okay, we have about 5 more minutes. So are there any other questions that you'd like to ask the doctor? Okay, and in the chat box, it looks like the website for Dr. Schultz Costello is posted, so you can reach out to her through that link. I actually have one quick question.
Oh, yeah, no problem.
I have a sister-in-law who is deathly afraid, and maybe that's not the right way. She's very afraid of mammograms, of screenings, of finding something. She has symptoms and she doesn't feel good sometimes, but she won't go to the doctor. What would you say to people who have that fear of finding something? Because, oh gosh, my life is going to change if I have, God forbid, if I have it. What could we say to those people that are afraid?
Yeah, the risk of finding something if somebody doesn't have symptoms, is quite low. And I would just tell them that the risk of cancer going undetected and the treatment that you would get if a cancer is more advanced is like completely different than if we were able to find a little early stage breast cancer. And so it's kind of like, again, the risk benefit ratio. Yes, like it's going to be scary to have a test, but on the flip side, there's a low chance that we're going to find something. And if we did, this is my chance to find something early stage. And again, when I say early stage treatment is completely different, it means that sometimes we're able to save the breast, where when cancers get bigger, sometimes we're not able to save the breast. Sometimes women don't need radiation if they have an early stage breast cancer. It hasn't gone to their lymph nodes, so I don't have to do extra surgery on their lymph nodes. And then I think one of the things that women fear the most is chemotherapy. And sometimes women don't need chemo when their cancer is found earlier. So the risks of waiting and not finding something just completely outweigh, the risks of the fear associated with getting testing. And a lot of women feel this way, and a lot of people feel like if they don't go to the doctor, they're not going to find out any, once they go to the doctor, all of a sudden they find out all of these different things that are wrong with them. But really they were there before, and it's like, again, our chance to treat and cure and hopefully prevent.
Thank you, thank you, thank you. Okay, well, it's now just about 10 o'clock. So I just want to open it up for any final questions, and we'll let the doctor have the rest of her day. No questions? All right, well, I want to thank you first for spending your morning with us.
Of course.
You've really given us a lot of great information today. And when we have this event again, I would love for you to return and share your expertise with us. So thank you.
Thank you guys so much. Thank you. Thank you. Have a great rest of your day.
Thank you. Bye-bye.
Bye, everyone.